more businesses start to reopen across the country, we're talking with local health experts about what you need to know to stay safe. We're joined this morning now by MU Healthcare infectious disease specialist and pediatrician, Dr. CHRISTELLE 5-19.mpg. And doctor, thank you so much for being on with us this morning.
Thank you for having me.
Of course. And I wanted to jump in because we're seeing a lot more places starting to reopen. Do you have any advice for when a mask is needed and when a mask is not necessarily needed?
So masks are needed when you are within 6 feet of other people for a prolonged period of time. And masks have to be really used in conjunction with everything else we recommend, the hand hygiene, the social distancing. It is not meant as a replacement for that. So I usually say if you are outdoors in a park somewhere, as long as you're keeping that 6 feet distance, you don't need a mask. But if you're going to be in a closed environment with other people, you cannot keep that distance and you're going to be in that environment for more than a few minutes, that's when it's a good idea to add on a mask to everything else that you're doing.
Okay. And now that many restaurants are starting to reopen their doors and their dining rooms as well, what steps should we be taking to protect ourselves when we're heading out to grab a bite to eat?
I think, again, following the similar guidelines to the social distancing, keeping the table sizes small, just a few people at a time in the restaurant, a few people at a time at any given table, and having enough spaces between people go a long way in helping reduce our risk of being exposed.
Okay. And we're also starting to see here in mid-Missouri a lot of sports starting to reopen back up. Baseball and basketball leagues, they may not be allowing games quite yet, but they are starting to allow practices. Do you have any tips for parents to consider before letting their kids head out to the ball fields?
Yeah, so the tricky part there is keeping that distance, right? In some of the sports that we have, I know that our state health department is working on guidelines that they'll be releasing for summer camps this month. They have already released some guidance, but they'll be releasing more this week, as a matter of fact, that can provide a little clearer guidance. So again, the key is to try to limit the groups of people that are coming together, to have a consistent small number of people time and time again in these leagues or these sports events, and to try and keep distances, the 6 feet distance between people as much as possible.
Okay, doctor, thank you so much for being on with us this morning. We'll check back in with you coming up in just about 10 minutes. And as more businesses start to reopen in the state, we're checking back in with MU Healthcare infectious disease specialist and pediatrician, Dr. CHRISTELLE 5-19.mpg. And we're going to talk about how to stay safe amid COVID-19. Good morning, doctor. Thank you for your time.
Thanks for having me.
Of course. And there's a lot of discussions right now on what school will look like for the fall. If students are heading back to school like it was normal coming this fall, is there any precautions families should take?
I believe we'll have more guidance on what schools will look like. But like you alluded to earlier, social distancing is going to be with us for a while. So figuring out ways to reduce class sizes, reduce traffic through in and out of our schools, and being able to do more monitoring of symptoms, fevers, and other symptoms of COVID-19 measures that we will be implementing. Some of that also have to depend on whether or not we see a second wave. There has been some concerns that COVID-19 will come back again in the fall, or it may be something that becomes seasonal once a year. So until then, you know, once we see what's happening there, that will also play into the decisions that are made when it's time for school.
Okay. And is MU Healthcare expecting that second surge of cases? And if so, are you all prepared for that?
We are definitely prepared. We had expected to see a surge after the state opened, and most other states that have seen a surge have seen it about 3 to 5 weeks after they've reopened. So we are definitely ready and expecting that, which so far we haven't seen that surge, which is a good sign.
Okay. Yeah, and that 3 to 5 weeks should be coming up here in about a week or so. So that is something we'll definitely be checking back with you on. And I also wanted to jump back asking about some parents maybe have been skipping vaccines for their children right now just to avoid coming into contact with COVID-19, maybe in clinics and hospitals. Is that a concern for doctors at this time?
No, we have most pediatric clinics or clinics in general have laid out very good plans to separate out sick children from healthy children. I know a lot of them do well visit in the morning and some sick visit in the afternoon. They do temperatures and symptoms check when you first come in, and so it's very safe to go in. What we don't want is to have a measles outbreak because our kids are not getting the vaccines that they need. So as pediatricians, we are urging parents to please take their young children to the pediatricians or to the regular doctor to get the vaccines that they need.
Okay, Dr. Ilbudu, thank you so much for being on with us this morning. We'll check back in with you coming up in just about 15 minutes. We appreciate your time. As reopening efforts continue across Missouri, we're talking with local health experts about what you need to know to stay safe. We're joined this morning by MU Healthcare Dr. CHRISTELLE 5-19.mpg, and she's an infectious disease specialist and pediatrician. Thank you so much for being on with us this morning.
Thanks for having me.
Of course. And a big concern for doctors right now is making sure that kids are still getting vaccinated. Can you talk more about why that is?
Yeah, so when COVID-19 started in March, April, we had told people, or February, March, we have told people to stay away and stay home and lock down. But there are still some essential services that children need, especially vaccinations. And we've seen across the board that those rates have dropped. And so we really urge parents to take their children in for getting the vaccines. Most offices are well prepared to do that. They are prepared to separate out sick children from healthy children. So it's entirely safe to take your children in to get the vaccines that they need if they've missed any, because the last thing that we want is to have an epidemic of measles or other vaccine-preventable illnesses during these times.
Okay. And during this time, how is MU Healthcare helping in this?